Let's talk about aortic aneurysm. Most important lines for FCPS exam. Aortic aneurysm. Aortic aneurysm is defined as an abnormal dilatation of the aortic lumen. The most common site is the infrarenal abdominal aorta. Ascending aorta is usually spared. It affects men 3 times more commonly than women and are estimated to occur in about 5% of men over the age of 60 years. Pathogenesis. The most common cause of aortic aneurysm is atherosclerosis. Smoking and hypertension predominate with 95% of patients. They're also specific genetic component. Marfan syndrome is an inherited disorder of connective tissue that is associated with aortic aneurysm and aortic dissection. Clinical features. Presentation is dependent on the site of the aneurysm. Thoracic aneurysms present with acute severe chest pain, aortic regurgitation, compressive symptoms such as stridor hoarseness, and superior vena cava syndrome. It affects the infrarenal segment of the aorta. The usual age at presentation is 65-75 years for elective presentations and 75-85 years for emergency presentations. Investigations. Ultrasound is the best way of establishing the diagnosis of an abdominal aneurysm. CT provides more accurate information about the size and extent of the aneurysm, is the standard preoperative investigation. Management. Distal embolization is a strong indication for repair regardless of size because otherwise limb loss is common. Open abdominal aortic aneurysm repair has been the treatment of choice and entails replacing the aneurysmal segment with a prosthetic, usually Dacron graft. Increasingly, endovascular aneurysm repair, EVAR, using a stent graft introduced via the femoral arteries in the groin, is replacing open surgery. It is to become the treatment of choice for infrarenal aneurysm. If the aneurysm is secondary to Marfan syndrome, treat with beta blockers. Like, comment if you want more. Don't forget to subscribe.